Okay, so welcome everybody to our first Peer Learning Forum of 2015. Yay! This is improving our practice, evaluating sexual violence prevention efforts, and we are thrilled to see you all here today. We are Prevent Connect, so as you're all introducing yourselves on the text chat, this let you know what you likely already know. We have our website, preventconnect.org. We're a community of practice focused on preventing sexual, domestic, dating, and related forms of violence. And you all do participate in that community of practice on our email group, our e-learning, and we have lots of other things to offer, such as social media. So for the tech today, I can see that a lot of you are using the text chat, and we do encourage you to continue to do that. So we have Rhonda from Florida saying, oh, the weather is unpredictable. We have some folks in Texas saying it's cold, sunny in Montana, Kelly says. Colleen says brr from Indianapolis. Yep. Looks like Texas is cold right now. Morgan and Austin saying it's cold. It looks like it's cold, but yet sunny in a lot of places. Wow. And Rachel, it's way too cold. So I won't say what it's like here in Pasadena. It's cooler than usual, but I can share the sunny with you all. So I want to ask you all to go ahead and raise your hands. You can see that on the top left of your screen. So if you could go ahead and just click that My Status button, raise your hand. You can use this if you're needing some attention, if you want to answer a question, if there's anything going on. We have lots of folks on the call today, particularly David Lee. I'll put David's picture up. And David is his voice that you all recognize is here. So David, hello.
Hi, Ashley. My voice is actually a little deeper than normal because I'm recovering from a cold, but I'm glad to be here. This is such an important topic, and this has been a peer learning forum that I have been wanting to do for about 2 years now. Diane Hall and I have been talking about this for a long time, so I'm glad we're going to get to finally do it.
Absolutely. So David's going to stay on the line here with me as we continue today. But we also have, and you'll be seeing a lot from them hopefully in the text chat, we have, oh, this is Abby Sims with her picture of her buttons here. And we have Dina Fulton as well. So our prevention colleagues are here as well, and you'll be hopefully seeing a lot from them in the text chat. So other things, please do remember that we do have a private chat. It's up on the top right of your screen. It's in a gray tab, says private. It's a good way to have kind of more in-depth conversations one-on-one with folks, and share your email address or information you wouldn't necessarily want put on the text chat transcript that we will be posting with the recording after this session ends. So if you are seeing the presentation slides, you are on the Presentation Slides tab, which is where you need to go. If that ever goes away, just click Presentation Slides on the top of your screen and you will see the slides. And there is closed captioning available. We thank our longtime partners, Aberdeen, for doing that. And in general, we just hope that this is a really interactive web conference. So it's a little bit different. It's Peer Learning Forum. If you've been on them before, we do have our web conferences. And coming up, we have just this Thursday, Using Popular Education to Engage Communities in Sexual Violence Prevention in partnership with NSVRC, the National Sexual Violence Resource Center. And there is still room to register for that. So Dina, if you could put that, looks like David just put in another link. But Dina, if you could put in the link for the next one, yes, that would be great. So we do have, David has put a link for today's slides, and Dina has put in a link in the text chat for registering for the Popular Education webinar. But today's sessions are different. We really hope to see a lot more interaction, and we have connected follow-up Peer Learning Forum sessions. So this is session 1 on evaluation. But on March 10th and March 30th, we will be doing number 2 and number 3, and you will automatically be registered for both of those as well. So I want to do a quick feedback question. And it's a yes or no question. So did you attend our peer learning forums last year? So on the bottom left of your screen, if you could go ahead and answer that. And David, as the answers are coming in, last year we focused on a lot of really great topics. We had public narratives and we had public sector partnerships, and it really was an environment with a lot of sharing and a lot of interaction, and so we were really happy to see that and looking forward to that again this year.
Right, and I see a few people are answering in the text chat, but Ashley, why don't you share from the feedback box how much, I guess you're the leader, so you have to share that.
Yes. I'm sharing now. Ooh, it was perfect forward for a second. But so it looks like, yeah, about 3/4 of you have attended these before, but some of you are new, and we welcome you. So we hope that you enjoy these, and everyone please fill out, and 30 minutes after the session we'll have an evaluation survey. Speaking of the importance of evaluation, and we really encourage you to fill those out because it really helps us shape these to meet your needs.
Yeah, and I have to say that these peer learning forums came out of comments from particularly those of you in this audience. This audience are mainly people that are from the RPE program, whether they're RPE directors, health departments, sexual assault coalitions, Delta focused, DV coalitions. That's the audience we did. And people kept on saying that our web conferences in an hour and a half introduce topics well, but we want to go in more depth and get more concrete. And so that's what this is an attempt to be able to get more concrete. So let's go to the next, what Prevent Connect does.
Yeah, so that's exactly what we're going to be doing. We're going to be getting more concrete around the things that we focus on around prevention. Today is evaluation, and it pertains to everything we talk about here at Prevent Connect. You know, the types of violence that we're focused on and the connections to oppression, and really connections to other prevention practitioners as well. This is a big thing for the peer learning forums, is that, you've heard me say it once, you'll hear me say it 1,000 times, is that interaction. We love to hear from you. And you know, we do go and we look at the text chat in between sessions. So from this session to session number 2 on March 10th, we're going to look at the text chat, and we're going to really see what you had to offer and what questions you had and how we can use that information to inform the next one to really be responsive to you. So David, let's talk about these learning objectives for this series on evaluation. We're really focused today on number 1 right here. So these really build on each other. And today is about identifying evaluation action, a particular tool from the CDC, and how we can use that in our training and technical assistance efforts. And David just underlined evaluation action, I believe. Thank you for that. Yes. So we're going to be building, next time we're going to be looking at, let me try to underline, NSBRC's evaluation tool, and Jen Grove is on here and will be joining us for that one. And we're really looking at how you're planning to and how you can and will and are wondering if you can incorporate evaluation and these tools into your technical assistance plans and training plans as well.
So you know, Ashley, this is so important because what we're doing here is really thinking about how to use this online tool that we'll be talking about in later, and then we're going to get a chance to actually practice between sessions. I think, are we calling it homework, Ashley? Are we calling it a?
No, we're calling it an assignment.
An assignment, but we do want to be able to find a way that we can get that learning so we can report back and learn from each other and think about how this helps us in our roles within these great domestic violence and intimate partner violence and sexual violence prevention efforts, such as Delta Focus and RPE. Mm-hmm. Oh, I love views. Very good.
Yes.
The yellow.
That was me, in case anyone wants to know my skills. So just wanted to know, so Jen Grove is on. She said, hey y'all, in the text chat. So, oh yeah, and yes, Mark, there will be homework, but let's call it an assignment, an enjoyable assignment, with the possibility of winning the best incentive gift ever. So you just have to hold on to find out what that is. So right now, let's welcome our presenters, folks who many of us probably know pretty well from the CDC, Centers for Disease Control and Prevention. So we have Greta Massetti. Hi, Greta.
Hi, everyone.
I'm really glad to be here and excited to talk to you all. Great. And we also have Diane Hall.
Hi everyone. As David mentioned, he and I have been talking about this for 2 years, so I'm particularly excited that this tool has launched.
Yeah, and David, why don't you say a little bit about how you know Greta and Diane?
Well, Greta, as you can see on the slide, is now the Associate Director of Science for the Division of Cancer Prevention and Control. But prior to that, she was at the Division of Violence Prevention. And Greta and I have been to many meetings together over the years. And a few years ago, a few of us were at a meeting for RPE stakeholders. And Greta gave I believe you got very little warning to give a presentation on defining evaluation and research. Wasn't it just a few minutes? They gave you a day warning or something to do a presentation?
Well, it was pretty much the right before the meeting we had a little powwow and we said, whoa, I think our division director at the time, Howard Spivak, said, hey, you know what we really need is somebody to do this intro. Greta, how about you? So we went with it.
And I found that it was really helpful, and in some ways it was great that it wasn't going through a bunch of CDC documents and using this, but it really became language that was helpful for us to think about it. And so I asked Greta, even though she has now moved up, while her heart will always be with violence prevention, she is now involved in cancer prevention and control, is to be able to share some of those thoughts, to have a conversation with us, to give some definitions to evaluation and prevention, just so we can get a little bit of a grounding. And then I thought that would set up with what, as Diane said, was something that Diane and I have been talking about for a while, has been the evaluation tool that CDC has developed. And I've had the chance to talk with the developers and talk with Diane as this has been going through, looking at copies, waiting for CDC's long process of being able to make it public. And I think that it's going to be something that can be of utility to us in providing our training and technical assistance and as funders for our initiatives. So that's why we have the two of them here. So that's why today's topic is, so we're going to hand it over to you, Greta, I believe, to start talking a little bit about public health research and program evaluation. What's the difference? So go ahead. You have the podium.
All right, that's great. So as David mentioned, this really started a few years ago with some conversations with, at the time, with RPE folks, and there had been an RPE grantee meeting in August. I think it must have been, thinking back, but maybe 2013 or 2012. And there was some discussion about evaluation, and we had these roundtables. I bet a lot of you participated in that meeting. And there was a discussion about how do people define evaluation and research, and what's the difference, and what are some areas of overlap. And I was one of the note takers at a table, and I noticed that there were a lot of different ways that people define distinctions between evaluation and research. And so some people were saying, well, if you have a control group, that's research and that's not evaluation. And some people said, well, if it's in a it's in a real world community using real participants, that is that's evaluation. But then if it's in a laboratory in a university setting, that's research. And people had different ideas, and we kind of took all the notes. And then, as David mentioned, we had a stakeholder meetings a few months later, and I think in the intervening time, it became clear to several of us that we just needed to clarify some of those distinctions and talk a little bit about how we can reach a common agreement around kind of what drives the overlap between research and evaluation and the distinction. And there are sometimes when the two are similar, and sometimes when they're different. So I'm hoping to just start a conversation here to discuss that. So that kind of introduces this idea of like, how do we distinguish it? What are the differences? How do we define these terms? So it looks like there's a question here from David. Did you want to jump in and
let's hear from the audience. What do you think? What do you see as the difference between research and evaluations? Go ahead in the text chat, and this is kind of actually a pretty heady first question. That's why we ask the weather question first. But what do you see as the difference between research and evaluation? Sometimes they're terms that people use interchangeably, I've noticed, and sometimes people talk about big E and little e for evaluation, but I'd love to just get your thoughts. Think about, what do you see as the difference between research and evaluation? I'd love to hear from the audience. I know you are thinking now and now starting to write, so it takes a little time. So go ahead, and I'd love to hear from different people about what they think the difference is. So Greta, research proves, evaluation improves.
I'm seeing some interesting evaluations for program improvement, which I think is as you'll see later, is kind of really pretty much hitting the nail on the head.
Research is collecting information. Evaluation is analyzing information. So I think analyzing goes in both of them. Research is more rigorous, but I think we can have rigor in both. See, this gets complicated.
Yes, it does. It sure does. Emphasizes the purpose. Oh, someone's seen my slides. So this is great. Everyone's kind of really getting into the details about the specifics and what it's about and what the purpose is and what the relationship to practice. So it sounds like there's some themes around how you do the work, what your goals are in what you are doing, who you might be partnering with, and those are all they're touching on really important components of the concepts. David, did you want to comment more?
Yeah, well, I think Nancy Bagnata put a really interesting comment. Evaluation helps us determine if research was valuable. But also evaluation helps us determine what we'd want to do research about.
Exactly.
And so it's sort of this interesting cyclical relationship, and so, that's great to see where everyone is being able to talk about this. So, Greta, why don't we talk about how you see some of the differences?
Right. And I think that this depiction of a cyclical relationship is really important to always keep in mind, because we might be sometimes talking about distinctions, but in the best of possible worlds, the very best, most useful research really drives and informs evaluation and is informed by evaluation. So even though sometimes they may be different activities, they really need to be integrated in terms of how they inform each other and how they work together, right? So I wanted to go ahead and put up here a few words that are the definition of research, and this is according to the federal regulations. So there are federal laws that define research, and according to the federal regulations, the definition of research is a systematic investigation to contribute to generalizable knowledge. And that is, it's kind of a mouthful and a lot of words, but what does that really mean? Because if you think about it, if you do a lot of public health practice, I'm sure you're thinking, well, wait a minute, it's not only about data, right? It's not, data are used in public health practice all the time. Sometimes you can have scientific methods that are used in research, and you can use some certain scientific methods in practice. It's a misnomer to think that knowledge is only generated by research, because oftentimes some of the most useful knowledge is generated in an evaluation context, especially in practice. And then how generalizable knowledge is can vary, right? You can have some research studies where you're really only learning about something that could fit on the head of a pin, and you can't really generalize it beyond that sample too much. So how can we use this definition that's fairly codified and really get an understanding and get a little bit deeper in those words? And I wanted to just talk a little bit about that. But I did want to kind of make this statement that as you can see from the definition, it's not about the methods at all. It's not about how you do the work. So you cannot define the two by the methods they employ. So sometimes you have comparison groups in public health practice. Sometimes you have certain rigorous methods in program evaluation, and sometimes you have less rigorous methods in research. It's just how those methods are used to advance the work, right? So as somebody said, I mentioned, they hit the nail on the head, that really the major difference between research and non-research lies in the purpose of the activity. And I have like a little graphic. It's not super sophisticated. It's not my strong point, but that kind of emphasizes for you. So essentially, let me see if I can do this. Here's hopefully you can see the little laser pointer. The purpose of research is to contribute to generalizable knowledge, and the purpose of program evaluation is to assess the success of a program in achieving its objectives in a specific population. And I'll peel those apart a little bit more, but you can see that really kind of what distinguishes them is the purpose, whereas the overlap is kind of in the middle. So it may be that they could be using similar methods. They could, they both could use a comparison group or not, depending on what the nature of the work is. The specific types of data collected could be very similar. So for example, you could have outcome data for both a program evaluation and or research activity, or you could have process measurement or implementation data for both. The type of program implemented can be similar, and whether you use qualitative versus quantitative data, you could use one or both of the other, or each, depending on the purpose. So I also wanted to because a lot of this distinction really hinges on this question of generalizable knowledge. I wanted to make sure I put in there the definition of generalizable knowledge so we have an understanding of kind of how it's defined. And generalizable knowledge is really about new information that has relevance beyond the population program from which it was collected. So you can see that it's really about who are we asking questions about, and who will benefit from this work, right? David, did you have a comment?
I was just thinking about, that this is actually important to, let me get concrete.
Sure. Yes.
So with evaluation, for example, the RPE program, I know I'm looking at the list of you. Many of you are involved in the RPE program and and you even are aware of your evaluation plan deliverables that are coming up. And so we look at this, and so that's program evaluation, trying to assess the success of the program in achieving its objectives in the specific population. But then I'm also looking at the President's budget that was submitted for this fiscal year 15, and in that budget the President had put in $5.5 million for research on the RPE program, which is then looking at trying to be able to do that research, which would maybe use some of the same methods or the data and look at the same areas, but be able to then try to come up with a generalizable information. So then that will be able to give us a different lens of looking at the issue that we're looking at evaluating, but in a way that's going to make us help make some even stronger decisions based on that information. So we're dealing with both research and evaluation, while what we're going to focus on is mainly how people can do evaluation. We want to make sure that it complements that research.
That's absolutely right. And so this idea of generalizable knowledge versus who benefits is really about, so if I want to figure out, I've got this program, I'm implementing it, and how are my participants benefiting? And it could be anything. It could be, am I having an effect on their attitudes and understanding and belief about gender norms or sexual assault? Or it could be, for the smoking prevention program, am I having lower rates of teen smoking in my county or my community? But if it's really about informing what I'm doing so that I can do it better and I can improve it and that I can continually have that feedback loop for my program, then it's really about program evaluation. If I'm doing it so that I can learn about these types of programs in general and then share that knowledge beyond my program independently, then it's really research, right? And that's kind of where that generalizable versus kind of the specific population distinction comes in. Now you can also notice that doesn't mean that if what I do, when I do program evaluation, if somebody can learn from it, that's great. And so that gets into the secondary purpose can be about generalizability, but it has to be secondary. My first goal needs to be I'm informing what I'm doing, and then maybe somebody can take what I learned and replicate it and improve on it or adapt it to their local community.
And now, Greta, Abby, and Rhonda seconds it, has a really great question. This is a challenge, and you referred to this already, Greta. Sometimes we've seen research where the question gets so narrow and that it only gives us, it's hard to get generalizable information, but especially when I'm reading journal articles, sometimes I see things that are research, but it's giving, or the condition, as Abby points out, sometimes the conditions are uncontaminated situations that we don't deal with all the complexity, so then it's hard to generalize it because it actually, and so sometimes when we see the term research, it's sometimes referring to things that actually are hard to generalize, even though that's what the purpose of research is. So, Greta, this is a big challenge.
Yes, yes. So, that is a really important issue because the issue of the purpose of research being to contribute to generalizable knowledge is about that is objective. Now, you could have an extremely flawed research study where you can't generalize because it's done so poorly, because they either sanitized the sample so much or did it in some particular way that you really don't learn anything generalizable from it. That doesn't make it not research, it just makes it bad research, right? I'm not saying that all sexual violence research is bad research. I'm just saying that in some situations that's what you end up with. But it's research because at the outset the primary objective was to conduct generalizable research. The important thing is to figure out how can we make that research more applied and more relevant so that we don't end up with something that can't be generalized. Does that help address that question?
That helps, and Patty points out that, of course, RP is not funded to do research. That's why I was saying, right now what we're talking about is evaluation, whereas what was in the President's budget is the goal is to hopefully find, President is advocating to create funding for research on RPE. We right now don't have that. And so we're trying to, so in some ways, to me, that's where the evaluation becomes really important, because then it helps us, what we do in evaluation can help inform those research questions in the future, so we can try to inform how research is done in the future, so we are doing good research that will give us the generalizable information. So I think that's a really, Jessica talks about some of the information that's being required. So this is really interesting. So let's talk a little bit more about sort of the key attributes that you have on this slide.
Well, that's very much kind of touching on these comments about, how we can learn from each other and how, what the kinds of peer learning that we can do from our work. And it's really, as you can see, the key attributes about program evaluation are about how well are you preventing or controlling a program, how well are you achieving your program objectives, but the benefits are for the program's participants, clients, their communities, the program itself, and that the data that are collected are needed in order to do that work, not for any other reason. And then once you have that, you can say, oh, look at everything that we learn. Now others can learn from it as well. Whereas in public health research, it's really about kind of the benefits extend beyond the program participants, and then you might be collecting a lot more data that exceed the requirements for those participants. So I want to give a kind of an interesting example that I've been dealing with that's not related to sexual violence, but I think it touches on this. So we have spent the last month or so helping with the Ebola response for CDC, and we were working on some program evaluation protocols to help West African countries. And there was one particular where there's a country, they are not interested in research for a number of reasons. They can't do research, but they really need to know what is the risk for sexual transmission of Ebola among survivors, because they really need to be able to tell their, when they have people who survive Ebola, they need to be able to tell them you need to wait X number of days or weeks or months before you have sexual activity. Otherwise, you're putting your partners at risk. And so we're trying to put together some protocols to collect data. And of course, you put a lot of people together, we have all kinds of different questions. We want to know, well, how many sexual partners do you have? And well, then let's ask them about drug use, and let's ask them about this, and let's ask them about that. So we put together this massive protocol, and the country came back and said, these questions are nice, but we don't need those data. We need the data about sexual transmission, right? Those other questions, that's research. That you're trying to answer those questions because those are interesting questions, but they are not necessary questions for us. So that, I think, kind of really highlights that as an important example of where, yes, it's important to, those are interesting questions, but the country is not looking to answer those questions. Those are not necessary for their program, for their participants, for their practitioners. And so it's about kind of finding those distinctions. I hope that helped. Any questions about that category? Yeah.
Let's go ahead and move on to.
Okay. So I think I mentioned this before, that the extent to which different methodological designs, how you select participants, whether you test, you can have hypothesis testing in program evaluation. That's absolutely, a key component. They do not differentiate. And another thing that comes up a lot is, well, if you're doing program evaluation, because it's not research, you're not allowed to publish your findings. And that is not at all the case. So we really need to be able to feed the literature with more practice-based knowledge, and we need to be able to do that by publishing and by disseminating information in the type of form like we have today.
So someone asks, has anyone published evaluation results within IPV or domestic violence prevention? Now this is a question that we.
Yeah, including those that don't work. That's a lot of times just as important, right? So let me. I'm gonna, while we have this conversation, I'm gonna put it back on the graphic so we can have this reflect on it as well. Right?
Yeah, no, yeah, I would love to see. I've been one of my jokes is I wish there was a journal of insignificant findings where you would find things that didn't have results, because unfortunately the way that journals work is that there's a bias towards having findings. But we can learn just as much about what doesn't work as what does work, but that's something that doesn't get put into the published literature nearly as much as we would want it.
Mm-hmm. And this is Ashley, and that's why I think it's really important with what Dina said, is that we can a lot of times we can partner with universities or classes, and we might not feel like, oh, we're doing rigorous evaluation, but it's still really useful information for us to have. We don't have a lot of evaluation findings, honestly, and every little bit helps.
Well, and I think that probably many people are familiar with the review paper that CDC just published recently that was led by Sarah DeGue, and I was a co-author on that, where we looked at what was published in the literature in the last 20 or so years around sexual violence and prevention programs. And we actually did find a lot of programs that had been published, and some of it was program evaluation, and some of it was non-significant results. But one of the challenges is that the overwhelming majorities of the programs that we found in the literature were college-based, sometimes 1 or 2 session kind of educational programs, and other types of programs that do deal with different populations and use different strategies are just not reflected in the literature. So there's a little bit out there, but we really need to expand the opportunity to learn about what's happening on the ground and put that out there in the literature and learn from each other as well.
And there are a couple of good points here. Rebecca points out that we can share, and it doesn't necessarily have to be peer-reviewed literature. We can share in other formats, such as she mentioned self-publishing, but it might not get disseminated as broadly. And then Deborah said, the concept of evidence-based should maybe be distinguished in this conversation that we're having right now. Mm-hmm. Mm-hmm.
Mm-hmm. Well, let's move on a little bit, Greta, to I'm sort of getting caught in the conversation and getting back to being a facilitate. Because to me, these are important pieces, and the reason that we want to do this here is I think that it's important for us to think about what we want to do and think about how we do it. So let's pose some questions for our audience. The first question is, what do we want from research? So what do you want from research for intimate partner violence or for either IPV prevention or sexual violence prevention. So want to get this, if this is your wish list, and you could be able to do this, what do you want to see from research? So let's go ahead and write down, this is sort of your opportunity to do this. We will share this with all funding agencies. I don't think we'll carry, I don't know how much power we'll have, but we want to be able to get us in.
And I think this is a place to get to Deborah's question as well about really incorporating evidence-based. Do we feel that we need evidence-based? For me, in my experience, sometimes when we get evidence-based, it's here's a list of 10, and this is not actually in violence prevention, but close in sexual health. Here are 10 programs that have been shown to be evidence-based, but they're not programs that I think will fit with my community. So then I have to think, well, if this is what's in quote the research, what do I need? So it looks like Deborah is saying state data. Nancy says more research on perpetration, absolutely, to assist us with primary prevention work. That's a conversation I know been having for years with folks at the CDC about how might we be able to make that happen.
And Aaron talks about broader information to help people make decisions. I wrote in, I'd love to see community level change, and not just measuring things on individual level, but on community level. And Cynthia talked about longitudinal data that we can look at that, and what beyond education works. So much of the evaluation has been on education. What protective factors should we work on concentrating on? More research on, Lauren talks about more research on the outer layer, and I know all of the Delta Focus people have been focusing their work, I love Delta Focus on the outer layers of the socio-ecological model, and yet this is a place that we know less about because so much is done on the individual piece. And so there's people want to talk about info outside of college campuses, so not just look at college. While we have this great focus on college campus, now we also need to look beyond that. Protective factors is a theme that's doing it.
Absolutely.
So boy, the themes I'm seeing are protective factors, outer levels of the socio-ecological model, and Rebecca talks about connecting the dots, which we've of course done Prevent Connect web conferences with, and how little we still have on some of those outer levels of what we need to do. So this is great.
David Abby's question makes me think about kind of operational definitions. When we say something works, well, what do we really mean by that? Let's kind of break that down a little bit more.
Yeah, and then sometimes that's when we need to go to evaluation, because then it's what is our objectives and are we accomplishing what we are intending to do, which is one of those questions that we move forward. And the other theme I'm noticing is around potential perpetrators. How do we think about perpetration? And so, and you got to write on, Deborah from Rebecca. So I guess that's Ohio folks. We're uniting with each other on thinking about these issues. So Greta, it's interesting to see this agenda that people have. And I know that you're now not in the Division of Violence Prevention, but I think these are questions that you're also. When I read the RFA, when I read the research proposals that go out, it looks like these are the questions that you're also looking for at CDC.
Absolutely. I mean, I think that this touches a lot on the themes and that are, and I think from where I sit, I work in communities doing cancer prevention work, and I talk to my colleagues who are doing STD prevention work, and these are the same themes that are arising. It's about how can I use, what are the data that I can use that can influence, that I can put in practice in my state, in my community? How can we make the research more relevant? How can you do the research that I can put into action? This is, and I think that CDC has heard that. The Division of Violence Prevention has heard that from its grantees over time, and they're starting to really shift kind of the objectives of their research and their agenda to make sure that we're answering questions that will be useful.
Yeah, and I hope that as we just think about NIJ research and from other parts of the other types of funding streams, that they'll begin to look at some of these other research questions. So, but now let's talk about the evaluation, and this might be. Oh, I'm sorry, we're jumping ahead. Oh, this is the problem of two of us.
No, actually,
Yeah.
iLink today has a mind of its own. So.
Yeah, iLink is.
Enjoy.
So what do we, as a movement, and as the movement of all of us doing this work, what do we need to be evaluating now? So what do we need to evaluate? And let's see if this is what's similar and what's different from this in this. So I'd love to hear from you. What do you feel we need to evaluate?
So yeah, like what kind of evaluation results do you feel like we need still? Still is probably not necessary to say. What evaluation results do we need? What are you looking for when it comes to evaluation? Not just research, but let's talk about evaluation and think about program evaluation, maybe types of programs that we'd like to see if they, as Abby said, quote, work, and what does work mean? So Jessica said programs attempting to address the SDOH, and I'm not exactly sure, social determinants of health. That's right. That came into my mind. Okay, great. Yes, absolutely. I can say I'm a huge fan of looking at those. So absolutely.
Yeah, and Rebecca talks about the challenge of how do we start looking at something beyond the curriculum in a box. Mm-hmm. And that I think is something. So, and how do we start looking at a systematic type of comprehensive pieces? Mm-hmm.
And you might have heard Abby, who actually is in the same office as me, Abby from Calcutta, saying "mm-hmm" when it came to that, came to Rebecca's comment. So absolutely a lot of support behind that one. Dina says innovations. We love that word. Like it when things are innovative. And absolutely, we have so much further that we can go. We can build on our existing work, and we can be innovative.
Kelly is right with me. Can we evaluate the RP program as a whole? I have to say, when Ashley and I are working on the evaluations for Prevent Connect, we don't want to measure we don't measure the impact of one web conference. We want to measure the cumulative effect of what we're doing, and actually we have to realize what we're doing and what National Sexual Violence Resource Center is doing and what CDC is doing, because that's the context, because no one works just in these simple, discrete boxes. I was trying to do boxes here. That's a lot more coming in.
Oh, yeah.
Oh, Colleen talks about qualitative evaluation of social norm changes. I think we have to learn more about how do we operationalize social norms changes and the measurement, and how do we do that. Mina talks about how effective curricula are in different rural and different settings, and we can really spend some time looking at the different types of settings. That's so important. Mine is in California, so there's that great diversity piece there, and thank you, Kelly, for the rock star reference.
Yes, I really enjoy that comment. Mm-hmm.
Yes, so.
Yes, yeah, lots of support for each other here. So go ahead and you can keep sharing, but we do have one more question for you all.
Yeah.
And that is, so when it comes to all of this that we've been talking about, what is your role? So research and program evaluation, what is your role as at the state health department, at the state coalition level, RPE, Delta Focus, partner program? What is your role in this? So I like really open-ended questions, really broad ones. Just how would you answer that? What comes to mind? So Tracy, it looks like that's Tracy's saying a reduction in intimate partner violence and effective community policing looks like another thing that we'd like to see in evaluation. Rhonda says preventionists unite. So I probably wasn't an answer to this question, but I do think that is our role. Our role really is to share with each other, to unite, to maybe work on sharing our resources to do evaluation together. Maybe we can do that. Really joining together in these efforts.
Well, to me this is going to be the transition, Ashley, to the next part of our presentation that we're going to have Diane talking about, is thinking about our role and then what tools are available to support us in the role. And we're going to move away from the research and more towards the evaluation piece. Right. But I want to be able to think about this, because what do we do? Because we're not going to be able to do all of this. Though it's great to see that some RPE programs met in Georgia last month with researchers to be able to have that conversation and vice versa. So Kelly, we'd love to hear more about that going on. What works best for programs in South Dakota? Aligning our evaluation tools so we have similar results that we can compare. And Rachel talks about just trying to educate local programs on how to identify risk and protective factors and make sure the programs are addressing them. And I love Morgan says it's what Lauren said above, which makes it harder to find because because so many of you are commenting. I can't do it. But it's about sharing our lessons and that we need to be able to find ways of doing it because most of the people on this call are in the state levels. You're either a funder or a training and a training and technical assistance provider, or some of you are also local grantees within these programs. And that how do we play the role to help strengthen and build and be able to do that and go beyond just having the conversation about evaluation, but provide so many of those tools. And so I know the Ohio folk who are on here put together a fabulous, how many pages was it, Deborah and Rebecca, of some of the tools, lots. Thank you. That was the official. That was good quantitative measurement there, Rebecca.
David, I think you and I were both at the meeting where that was first distributed. So it was a very exciting, kind of first of its kind in a way to get and to be able to see. Okay, this is what another state has done and how it works for another state.
Great. So let's move to the next part of this and talk about evaluation. This is a tool that's going to be available, and I think, thank you, Greta, so much. Are you going to be able to stay with us, Greta?
Yes, I'll be able to stick around for a little while, and I'm really enjoying this conversation, so thanks for including me.
Well, thank you so much. I really appreciate it. And now we're going to move to Diane Hall. And as I say, with evaluation. And Diane, we want to give a chance for you to be able to share this tool, because to me this is a tool that I want us to do. And what we're going to ask you to do is Diane's going to give an overview of evaluation. We're going to go through it a little bit, but then we're going to ask, this is your assignment, or Mark is trying to keep away from homework. I'm waiting for the note about dogs and eating homework assignments. But is for you to go through before our next web conference, and we're going to look at evaluation and think about what you can use, what support you need, and think about how it's going to be useful in your role to move forward to help advance some of these questions. So Diane, great to have you with us.
Hi, it's so great to be here, and I want to echo what Greta just said. This has been a great conversation, and I'm scrolling up and down through the text comments, and there are just some great ideas in there. So I'm very excited this will be available as a transcript. I can't wait to actually look at it instead of just having to scroll through it. So thank you everyone for being here, and as I said earlier, evaluation has been a few years in the making. It did I think it set the record for how long it took to go through some of our IT security clearances. It just got stuck, and it finally launched in November, and so we're very excited that it is available and live. So it is on our Veto Violence resource. And oh, there we go. So question, are you familiar with evaluation?
Yes, so this is going to be a feedback poll, and I'll go ahead. I'll share it. I'll share live with what you all are saying. If you're familiar with it, looks like many folks are new to this, Diane.
Good. Then I won't be talking to people who've already seen it, and they're just sitting through this. So evaluation is also pretty new. It did just come out in November, as I said, and we haven't really done a separate big promotion splash for it because it launched in conjunction with the new look and navigation of Veto Violence. And so we were wanting to promote Veto, and there were some other tools on there, like Adverse Childhood Experiences, snapshots, and things like that. So there's a lot of stuff that all came out at once, and we didn't really do big splash kind of thing. So before I sort of jump into providing some context, I just want to talk a little bit about the numerous folks that were involved in this. So I was the project lead, and Linda Dahlberg also played a significant role in developing the final product. Our communications team here at DVP, but then Banyan Health Communications was the contractor that had this contract, and those are the folks that worked on it. But throughout the development, part of what we wanted to make sure that we did was we wanted to develop a tool that would be relevant for actual practice. And so I was meeting regularly with different folks just to get some feedback on it throughout the process. And so Karen Lang, who many of you may know, weighed in significantly, as did Nadal Karim and Teresa Armstead. I also talked with project officers who worked with Delta and RPE, and just got a lot of really helpful information from them. And then David took a look at it earlier, as did Jen Grove from NSVRC. So I just needed to put a shout out there that there were a lot of people that were weighing in on this. All right, let's see. So just some origin story kinds of things. Our working title was Eval 101. First, we're really bad at coming up with working titles, so they're usually pretty basic. But what's interesting about this is it reflects our initial conceptualization. And so we came at this initially thinking that we needed a training video on program evaluation. And at first we thought it needed to be for our RPE grantees. And the idea was that if we could just get grantees and their partners to understand how to do evaluation, that would fix it. People would do the evaluation, and it's just it's a knowledge gap more than anything else. The reality is there are actually different ways to acquire evaluation capacity. Sure, grantees can decide that they really want to learn a lot more about program evaluation and take courses and things like that. Or they could hire somebody that actually went to school to learn how to do this and spent semesters and semesters learning how to do it. They could create partnerships with universities or other local entities that have that capacity. So this initial thought that everybody needs to learn how to do it wasn't really making sense in all contexts. So we did a pause and regroup, and what we realized was we were trying to create a 60-minute sort of press and play video. And what we ended up figuring out was it was the exact wrong amount of time. So a 60-minute video is not going to teach someone how to do a program evaluation. So it's too short. There's a lot of information. It takes a while to learn how to do evaluation, and 60 minutes just isn't going to cut it. But on the other hand, it's too long to do really basic introductory kinds of things. And so we sort of started over, went back to the drawing board. And as we did that, we realized there's so many different evaluation resources available. We knew that NSVRC was working on their training that's available now, and we didn't want to duplicate that. One of the questions we typically ask is, what's the value added of having CDC create whatever this product is? Or is there a product out there already that will already do it? And so our colleagues across CDC, a lot of them have created evaluation templates and evaluation guides. So it didn't make sense to recreate the wheel. It's not a good use of time or money. And as I was talking with our project officers, I realized the problem isn't really a knowledge gap. Folks that get really excited about program evaluation assume that there's already buy-in and that people understand why they would need to do an evaluation, and that they're just going to jump on the bandwagon and embrace it and just become really, really excited, and they're going to become advocates for evaluation. And that's a pretty big assumption. And what I also realized is there's no marketing, there's no selling, there's no PR campaign to sell program evaluation. There's just this assumption that people will understand why they need to do it, and they will do it. Or they'll do it because their funder's telling them they have to. So we did a reboot. And what we realized is that a lot of grantees, and I'm using that term broadly, so that can be state, local, any partners, community-based organizations. People are a lot of times already doing activities that fall under what I call the evaluation umbrella. And so if they are systematically collecting information because they need to report to a board, that's an evaluation activity. They're just not calling it that. And part of what we were hearing was that program evaluation is sort of thought of as it's too technical, it's too expensive, it's only going to give me bad news, I can't spend my resources on that. And so we wanted to come up with some communication to address some of those points. And our stance is that program evaluation is a tool to help improve the work that's already being done. It's just another language to tell your story. So sometimes a really good anecdote is exactly what you need, but depending on your audience, sometimes you need data. And so this is just another tool to put in people's hands. The other piece is that because this is an online resource, the content, including the volume of the content, and the creative presentation needed to support these points. So as an example, if I'm creating a resource and I want to tell people this is not really technical and it's not going to take too long, I need to tame the volume. Everything I know about a topic or everything my colleagues know about a topic is not necessarily what everybody needs to know about a topic in order to do something. So content taming is something we do a lot of. And that's where those reactions from the audience or their thoughts from the audience become so critical. Let's see. So speaking of audience, who's the audience for this? So programmatic grantees and partners. And this is basically anyone who's unfamiliar or uncomfortable with program evaluation, anyone who's finding themselves in the position of needing to sell the benefits of evaluation. Evaluators sometimes ask me if this is going to put them out of a job, and the answer is no, it's not. Until I can get enough money and the technology's there for virtual TA without a human, we're not there yet. So this is a tool for folks to use. And the point is to increase buy-in and help, I'm going to use the word clients, help clients understand what the benefits are of evaluation. So evaluation is and what it isn't. So it is an approachable introduction to the benefits of program evaluation. It is not a tool for conducting that program evaluation. It's a way to introduce evaluation concepts in a non-technical manner. And it's not a resource that includes more complex or technical information. And we'll see this when we get into it. So research design and data collection and data analysis, as we've heard, can be really important parts of an evaluation. The technical information in those areas was not included in evaluation. There's information about it, but this was not meant to be something that people would use to do the evaluation, is to plan it and think about it ahead of time. So it is a way to sell evaluation. It's not a replacement for an evaluator. It's a way to start a plan. And it's not just for people working in violence prevention. So on one of the earlier slides I said that we initially were thinking this was needed for just RPE grantees, and to some extent evaluation is evaluation. It doesn't really matter what you're evaluating, and so we wanted to make it cross-cutting and broad enough for anyone working in any area. So because we were specifically trying to design something that was going to sell program evaluation and counter some of these ideas that it's too technical, it's too hard, we specifically came up with something that was warm, engaging, approachable, and fun. And I've had several people tell me this doesn't look like a government site or government resource, and I'm not so secretly proud of that. I think that's important. And so we're going to do a walkthrough. I'm actually going to let Ashley drive at this point.
Great. So I'm taking the wheel. So what I'd like to do is I'm going to try to share my screen. I'm going to do some moving around here for just a bit, trying to get this. Okay. You can probably see a little piece of it, and trying to make it bigger for you all. So make it bigger. All right. So, and Diane and David and anyone who's on the phone, if you can just confirm for me that you're seeing what we should be seeing, that would be great.
We are seeing what we should be seeing. We are now on the Veto Violence, the new Veto Violence website.
Yes, absolutely. And so David, if you could also just, if you're able, to let us know if anything comes up in the text chat as well, as I am not able to see that. So let me just remind people that they should, if you have questions or comments, put it in the text chat and we can keep up the conversation. What our goal here is just to run through this, but then we are looking for all of you before our next one to spend the time to go through the evaluation. But first we're going to show you how to find evaluation from the Veto website, right.
which is not always intuitive.
So if you go to vetoviolence.cdc.gov, and then I'm already over here, you can see I'm already logged in. So I've created an account, I've registered, and that's the first thing you have to do is you register and log in. And it is not in any way a difficult process. And then I have to remember that for you all there's a little bit of a lag usually. So I'm going to try to pause a bit, but just feel free to chime in if I need to slow down. But we're going to go to Tools and Training. And then from there we're going to go to Evaluate Action. You can see under there's Violence Prevention Basics, and then there's Tools and Training on the right. And I'm clicking on Evaluate Action. And I did not highlight it. There we go. So it's going to pull up Evaluate Action with the cool graphics. Always impressed by the graphics, the visual.
I love the graphics.
Yes. So you should be seeing the Evaluate Action page. And I'm going to go to the bottom, and I'm going to click on Evaluate Action. And I'm there. So I'll give it a little bit of the pause for you all to catch up with if you have the lag in the real-time sharing. And then Diane, if you could just start with kind of an overview of the site, that would be great.
Sure. So I actually want to talk a little bit about the registration idea. There's this big warning box when you go to set up your profile that you have to have an approved domain name, and it has to be a .gov or a .mil or a .edu. And for the most part that is true, but one of the things that I've been able to confirm is that if you've got a partner that just doesn't have access to that email domain for whatever reason, they can still register with like a Gmail or a Hotmail. It just needs to be approved on an individual basis. It won't automatically be processed. So if you've got partners that you think could benefit from this tool, they can definitely go ahead. So don't be put off by the warning box that it needs to be a specific domain name.
Right. Diane, there's a question. Diane, there's a question. Yeah. Do you have to register and get a login to be able to navigate the site? And I think the answer is no, but there's certain features that there are value added if you do.
Yes. So one of the new features of Veto Violence is that you can create a profile and log in. And what that means is you can save things. So what we're going to walk through right now is content that's available to anyone, whether they have a profile or not. But at the bottom of the page, and this is a long page that you scroll through, there's a button you click on to go into an evaluation plan builder. If you want to save an evaluation plan, you have to have somewhere to save it to. So that's when you need the profile.
And I'm just going to
Thanks, Rebecca. That was a good question.
We'll get to that. We'll get to that, but I've scrolled all the way down, and there is a very easy to highlight plan builder. So we will get to that in a moment.
I want to encourage people to set this up because in terms of for you when you explore this, I think to see the utility of the site, you want to try it as when you log in, because that will give you more ideas of some functionality. There's actually a logic model builder in that evaluation builder, and that's something I think that you might be very interested in. So this is a value-added thing, but it is mean that people do need to log in, which is a little bit more of a complicated process. So thank you, Rebecca, for asking the question.
As others would know, probably likely on this web conference as well, is also logging in and registering usually helps with some of the data that we need for our evaluations. So we can see things like how many users do we have, and it's not just guests and things like that. And that's also very helpful on that side of evaluation as well.
Absolutely. So one of the first things we do is we start with just a basic introduction video, and some of the little animated characters are throughout. And I see Ashley's pressed play but muted. And so this is sort of the public service announcement for program evaluation, or it's the introduction of the cell. So the idea is that it might seem daunting, but it doesn't have to be. And so we're going to present some resources and some information that can help with that. Some of the things that we did, as I said earlier, this does not look like a government website. That was done deliberately. We specifically wanted something that was warm and engaging, and we wanted something that was easy to navigate. So that's part of the reason you just scroll down. You don't have to click and get lost in a lot of pages. And the navigation bar on the left actually moves with you. So it's the anchor that keeps you connected to the whole content. So that video is taking a while to buffer, or it paused.
Oh, yes. You can see my street here in fabulous Pasadena does not have fiber optics. So, so that's some of the, this of course depends on your connection quality and speed. So.
Right. But I will encourage, as people watch the videos in the meantime, that's one of the things we're going to check back in with you. And are these things that would be useful for you in the work you're doing? So why don't we go on to the next piece, because I think this is going to take a while to get loaded.
Yeah, I think so too.
So just to show you all, you can scroll down as well. So as Diane was saying, you can scroll down and hover. You can click podcasts and things like that. But you also have this anchor over here. So when I'm going to myths, and I'll click a couple of them for you. Diane, is there anything you want to say about the myths?
That's actually not showing on my screen. I don't know if it's showing on other people's screens.
It is not on mine either.
What are you seeing?
Still the video that didn't load.
Oh, I think it's just the lag. So
now
all right, so, yep, there we go. So let's just
I'll give it more time for the lag. Mm-hmm.
All right.
Oh, and mine
jumped too far.
Decided to go back. Okay. So mine just went back to iLink, so I can go back to it. Okay, you're going to have, in a few seconds here, you're probably going to have it jump back to the slides. I don't know why it doesn't want to show this. Interesting.
Okay. It's now showing.
Is it? Okay.
It is, showing myths. So there's a section right before this that makes a case for why evaluation is important, and it talks about value, increased confidence, and accountability. And there are little audio feeds that you can click on with different people that we talk to about what does this look like. In terms of myths, these are just reasons that we've heard people give why they don't want to do evaluation or why they think they can't do evaluation. And as I said earlier, a lot of times they're already engaged in evaluative activities or evaluative thinking. And so this was just to provide some additional questions for people to think about, just to challenge them to, maybe not so fast. Maybe it's not too complex. Maybe there's something more scaled back or less complex that you can do. I can just tack it on in the end. That's pet peeve of every evaluator I know. No, you need your evaluator at the beginning. It's going to help with your design, help your focus, and increase the likelihood that you'll actually get information that you need. So there are just a few of those, and the navigation is you just click on it and it sort of falls away, and then you see the content underneath it. The next section down,
and it is coming to you. So, defining program evaluation.
Yeah. So this is just where, and I'm just going to talk and hope that it pops up. So this is where we decided to deconstruct or take apart the technical definition of program evaluation. And so there's a magnifying glass there, and if you move it over to the text that's highlighted, it will give you more of a plain language definition. And essentially, my plain language translation of what program evaluation is, it's systematically collecting credible information so you can tell more about your work. And so we don't really need to have that technical definition to be able to do the work. A lot of comments or questions that I got early on was, why was I not talking about formative and summative evaluation, and why was I not talking about inferential statistics and things like that? I'm like, well, you know what? It doesn't always matter what you call it. People need to understand what it can do for them first. This is quite a lag, Ashley.
Oh, I'm sorry. I'm sorry, Diane.
Yeah, I'm still seeing myths on my screen.
Interesting.
I too am at the same place.
Okay.
It worked during practice really well.
It did.
Didn't it? Okay, let's see. Maybe let me go back. Oh, iLink is not very happy with me right now, David. I might need you to take this over.
Okay. Why don't I've got the podium. I have to go into evaluation. I have not logged in. So I'm going to move to people of evaluation, and I'm going to go. I'm going to close. Why don't we close your share?
Well, that's the problem right now. Let's see.
I'm
Okay.
able to close your share for everyone, and I'm going to go share
Okay,
mine.
thank you.
This is teamwork
Yes.
in action and the advantage of being in two different parts of our, not in the same office. Except it's not working for me either.
Uh-huh. So, well, we've
I'm
gotten
doing
pretty far.
I'm doing the share. I'm going to try the desktop share. See if that works.
Mm-hmm. Yes, and I'm sorry, everybody, but I actually know several of you have dealt with this, but iLink is actually frozen for me at the moment. So, see if we can get that cleared up.
Okay, at this stage, it is not. The share is not going to work for me.
Okay.
It is. I am. So what we're going to do is, I think we're going to go move on and not do more of this. But the goal is to encourage you. The one that I think I want to highlight is we're going to actually ask you, your assignment, as we called it, is to go through evaluation. And we will learn if all of you have problems with it freezing on you, then that will, actually the evaluation is working fine. It's the, here, is I want you, there's the myth section, the defining program evaluation, there's people of evaluation that shows different types of roles, which include survivors and community members, neighborhood associations, school, state and local health departments, schools and education groups, legislators, policymakers, funders, and program evaluators. There's the framework that they have on program evaluation. What can I afford? And there's actually a chart about how much it costs with examples from 0 to, I feel like this is the Zagat guide of evaluation.
That's where we got the idea.
So we have the 0, and then $1 sign, $2 signs, or the $3 signs options. There's some do's and don'ts in the evaluation, which is a pretty interactive piece. Then evaluate about how to create your evaluation team. And then the one I think you want to spend the most time is building the evaluation plan. And there's a lot of questions in there. So I want you to think about this and have either your actual work or just an example of some work and go through and try this. And as you do it and as you try it, now the slides disappeared too.
Yes.
I'm restarting those now. So I got those. People should see their slides. So we are going to be able to have that. I want you to go through and look at these and come back. And for those of you that do, we will randomly select among all those who have. This feels like now my car talk impersonation. We will give what Ashley has called the best incentive ever, which is and Jenny Dills will appreciate this because she wanted one. This is the collector's edition of the Prevent Connect bag, which Jenny says yay, and Rhonda wanted world peace, but all we can provide is a bag. It is actually the old Prevent Connect logo, and this was given at the National Sexual Assault Conference in 2010. And so we will have a bag, and we will randomly select among those of you who have done this to be able to win this bag, and we will send this in the mail. And our colleague Valena is demonstrating what the bag looks like and how much you can use that. And so we want to be able to take advantage of this because we're going to have a discussion about who was this useful for, what other preparation do you need to do this to be able to use this, and then how can you use this in as a funder, as a training and technical assistance provider, or as a local agency, how would you use this work with what audiences? Maybe it's with stakeholders, maybe it's with your grantees, maybe it's with your staff itself, but to think about that tool. So we have the best incentive ever, and these are the guiding questions that you'd be asking.
So, David, I'd like to point out a couple things about the navigation that might not be immediately obvious to folks. The first is that you can, as I said earlier in response to Rebecca's question about needing a profile, you can save and edit plans, and you can save them as Word files or you can save them as PDFs. So if you've got one that you want to share that you don't want people changing, you can just PDF it and send it to them, and Veto Violence will save it for you. You can go back in and edit the Word versions as many times as you want, and you can save as many plans as you want. I emailed the programmer this morning to find out what the upper limit was, and apparently there isn't one yet. There isn't a way to delete a plan, though. So if you decide there's a plan you created that you just don't want anymore, you can edit it to look like something else or ignore it, but unfortunately we don't have that functionality. The tool builder has a bunch of questions to help the user begin to focus about why they want to do an evaluation. And some of the key points we try to make is that the information you're gathering should be applied in some way, it should be useful to you, and that there are other people that have a stake in this. And so there are questions that ask explicitly, who's going to help you with the evaluation? Who are the stakeholders that need to know about this? You don't have to answer all the questions in one sitting. You can skip as many or as few as you want because you can go back in and edit it later. There's a couple different ways to navigate. There's a next button at the bottom, so as you're going through, you just answer the questions in sequence, or if you just want to skip ahead, there's a number line at the top that maps onto the CDC 6-stage evaluation framework. But part of the idea is that we wanted to create something that helped show the logic and the connection between inputs and activities and outcomes. And what we're hoping is that this can serve as a tool to help guide or structure discussions between the evaluator, and I'm putting that in little air quotes, and the person who wants the evaluation, the client, for lack of a better term. And we think this can help highlight gaps in understanding or connections that haven't been made yet, or areas that still need some additional thought or some additional clarification. There's a piece in the logic model builder that gets people starting to think about their access to data and measuring things. The logic model, you can just skip right to it, but it's also part of the plan builder, and you can download it and save it separately. And you can add your own organization's logo to the evaluation plan. So when you go into the first page to save it, it'll ask if you want a placeholder for your logo. And so you can do that. And that's sort of it for my page of tidbits about the plan builder.
Okay, and I can't remember my password. They're making me change my password. You can see I'm sharing it now, but I'm going to stop because I didn't get in there. So we're going to ask for people to be able to do that, and the questions that and Ashley, you are back on the computer.
I am, yes, I am. And so hopefully you all are seeing these guiding questions. These are some, and there are, of course, many more, and they can be phrased differently as well. But we really want you, as you're thinking about this, to think about, is this useful not only to you, but what about your local programs? What about other stakeholders? So as we would with anything, thinking about, who is the audience, who are our stakeholders, and how is this going to work or fit for them? Also, as David had mentioned, what else is necessary? Do you need more information? What about training? Is there something that you need, some sort of assistance there? Would you add something to complement this, or can you incorporate it into something that's existing? And especially thinking about your plans. How might this fit into your plans for providing training and technical assistance as well? And again, as I said, there are many other questions. And we're going to be going through those types of questions and really get your feedback here. You're the perfect audience for this. You're the ones who are providing training and technical assistance. So we want to talk about how can this tool assist in your efforts to do so.
So this I think is Ashley, is a really great opportunity. And so this is a little new for us at Prevent Connect, having a assignment or homework or this, but we also are giving a prize. And I think it's going to be a great opportunity to learn from us. When I went through it the first time, I know Ashley, I felt there were certain things that actually would require people to get training before they would look at it. And perhaps understanding, for example, the difference between inputs, between outputs and outcomes, and that there's ways that we want to be able to think about that. And so that's why it's important for us to be able to advance and figure out where we can do this and where this utility can be. So when you go through this next session, Ashley, we're going to go spend talking about this For the first half, we're going to talk about the lessons learned. We're going to hear from your experiences. So this session is going to only be as good as you being able to go through it and having feedback. And then the second half, we're going to have, next week, we're going to have the National Sexual Violence Resource Center sharing their evaluation e-learning unit, and we're going to have them give a guide to it. And then the following week, you're going to go through and do that one and see what works well for you and ask the same types of questions so we can see how we can use that and how we can incorporate it in our TA. So any questions that people have, before we move on to conclude today's session? We're going to end a few minutes early since our tour unfortunately got to be shortened. So, and great, 2 weeks it will be there. These are 2 weeks. We give people time to do this. So, people want to show.
Yeah, I want to.
Someone said, can we get a copy of these slides? Yes, you can. All the slides are available. I'll post the URL right now.
Mm-hmm. Yes, and you will automatically be registered. Today or tomorrow, you will be getting an email confirming your second session. You're not getting all 3 sessions confirmed at once because that makes it confusing. So we're going to go ahead and spread the confirmations out for you all. They assure you don't have to do anything else to be registered for the rest of the sessions. And I'm just looking at the text chat. So really, I do encourage you, anything else you want to know, Sarah already put something in here about trying to use the interactive videos and the presentation tools. So anything else like that, we do, as we've said several times, we've gone through the slides, we go through the text chat, and we really do incorporate your comments, your questions, your expertise, some of the themes that have been coming up as well. So feel free in these last few minutes to type in anything you want in here. Well, not anything, be reasonable. But Diane has been generous to provide her email as well. So if you do have questions, if you're maybe getting stuck somewhere, other questions like that, feel free to ask Diane. You can also, I'll offer up my email as well if you have any questions. As someone who's fairly familiar with this, and as the person who's given you the assignment, it's only fair. So I'll go ahead and put my email in this as well. It's ashley.meyer@calcasa.org. So go ahead and put that in there. I guess I won't put David Lee's email in there. Just this time, David, just this time.
Already did it.
Oh, okay.
But I think, and I saw that Mark was saying the question about having these videos available as videos, and I know that that's something that I think many of you might have interest in. First, let's look next week and see how useful if you find them useful, then that will be helpful information for Diane as she can explore at CDC what can be made available. Perhaps those videos can be made YouTube videos, and we can show you easy ways to download videos from YouTube. Mm-hmm. So I know that's a little bit more complicated.
Well. Mm-hmm. Yes, it is. So, yes, Sarah, it is amazing. It's amazing. I do that a lot in teaching, so especially when we're not sure that, for example, we might get kicked off of the Internet. It's always good to have even just a backup. So March 10th is going to be the next session. David already explained to you what we'll be doing there, starting off with you coming back from your experiential time with Evalu Action. And then Jen Grove, we will be welcoming you from the National Sexual Violence Resource Center to introduce your tool, and then we'll do the same process with that as well, and have some nice conversations about evaluation and some of the things that informed that tool and what other folks have found from using that as well. I'm looking forward to that. And this is our closing slide. So really, yeah, Jen, thank you for also looking forward to it. I appreciate that. But yeah, really go ahead and think about application through this whole process. We're really focused on application. I like to say I'm an applied person, and hopefully this is a chance to prove it to you all that we're looking at how can we apply these concepts, these thoughts, these conversations, the sharing of our expertise, all of that. How can we apply this to our work? And I'm thinking about it just along with you all, just as you are thinking about it as well. David, do you have any last words, or Diane or Greta? Not last.
Well, I want to really thank Diane and Greta. I think, Greta, you helped give us a foundation of thinking about evaluation in the broader evaluation, in the world of evaluation and context. And Diane, thank you for sharing this. And I want to really thank most of all of you. I look forward to our conversation that we're going to have in 2 weeks, where we'll get a chance to be able to see what our experiences are and learn from each other. So with that, Ashley, I think it's time for us to say so long.
Yes. So thank you,
everybody.
Thank you, everybody. Thank you for your, at a time I noticed a healthy humor being used. I always appreciate that. Please do continue to fill out those evaluations. You'll get one for a link to the evaluation in about 30 minutes. And again, you will be getting the confirmation today or tomorrow about the second session. Thank you all. Contact us with any questions. We look forward to seeing you online in about 2 weeks. So that officially ends today's Peer Learning Forum Session 1 on evaluation. Goodbye.